Hi, this is Joseph Pate, better known as Medicare Joe. In today's video, I'm going to be discussing Medicare Supplement insurance versus Medicare Advantage insurance. From one of my last educational webinars that we put on, I was able to record this piece and bring this content to you. I call it the two roads of Medicare. You gotta pick one of these options when getting onto Medicare. So be sure to like this video if you enjoy the content, as well as click the red subscribe button in the bottom right-hand corner to be notified when we post any new YouTube videos. Stay tuned. And that leads me to what I call the two roads, and I tried to make a little graphic here for you. Basically, there's two roads or two pathways when you're getting onto Medicare that are gonna make sense for you to do. And this is always the first decision for someone to make, is to decide what road they wanna go down. So one of which is Medicare Supplement or Medigap policy. And this is something that would be added to your original Medicare. The other is Medicare Advantage, which is Part C. And I want you to take this note down. If you're taking any notes, this is the note to have. I'm going to bring up the right side of this piece of paper in a second, but this is going to be the best illustration to decide which road you want to go down. Again, the left side would be original Medicare as your primary insurance, and then you'd be adding a Medicare Supplement to pick up the gap that Medicare doesn't cover, which I just illustrated, the exposures. And then you'd be adding a Part D drug plan. So this is one way that you can have your insurance work. The other way on the right side is Medicare Advantage. So again, this would be the alternative to Medicare. I'm gonna go over that a little bit later and discuss how that works. I'm gonna start with the left side, and then we're gonna come back to the right to try to make it as easy as possible to understand. So when we break down the left side, the Medicare Supplement option, basically how this would be structured is you would have original Medicare as your primary insurance. Let's just say it's covering you at 80% to make it easy. Let's say Medicare covers 80%. You would then add a Medicare Supplement plan to pick up the 20% gap that Medicare doesn't cover. So what you're effectively doing here is you're paying an additional premium for the supplement to avoid having to pay any medical bills out of pocket because you now have 100% coverage. There's a lot of benefits of having a Medicare Supplement. I've listed some of them here. Basically, there's no large out-of-pocket expenses that you'll have to worry about. If you're hospitalized, have any surgeries, you're basically paying nothing. You have the freedom to choose doctors and hospitals. There's no networks or referrals that you have to worry about. The biggest one here is there's no prior authorization. So what that is basically if Medicare deems it medically necessary and you and your doctor, choose that option to go with, whether it's surgery, etc. If it's medically necessary, it's going to be paid for. You're not bringing in a third-party carrier, insurance company, to determine if it's allowed or not, right? So no prior authorization is a big one for Medicare and a supplement. And this is also a guarantee renewable product, so it's not going to ever be terminated. The only way you can be terminated is if you don't pay your monthly premium. So again, a lot of benefits of Medicare with the supplement, and I want to go one step further into the weeds and kind of look at, okay, we have this 20% gap in coverage, and if we look at this chart, basically this is illustrating how that 20% can be covered. So this may look like a lot, but we're going to make Medicare simple. So I've highlighted two plans here. And these two plans are basically really the only options that ever make sense for someone to pick when they're getting onto Medicare and they want to go with the supplement plan. Because, as you can see this chart, they cover the majority of the exposures that Medicare has at 100%. One thing to note before we go into the plans and how they work is that the supplement plans are all standardized. So what that means is a plan G with one carrier is the same exact thing as a plan G with another carrier. They're no better, no worse. So when we're talking in terms of a plan letter, no matter what company is out there, they're all going to provide the same level of coverage for that plan letter. So Let's talk about Plan G, and if we had chose this as our supplement, how it would work. So Medicare Supplement Plan G and how it covers the 20% gap is it's going to cover the full 20% gap in coverage for Part B. It's also going to cover the hospital deductible that you have on Part A as well. So if you chose Plan G to be your Medicare supplement and work with Original Medicare, the only cost that you'd actually have on the plan is a one-time deductible of $226 for the year. Once you satisfy this deductible, no matter how many medical bills you have come up, you pay nothing. Everything's covered by Medicare in your supplement. So this is like your Cadillac tier, top tier coverage that you can pick. Coming back to the chart, I want to go over Plan N. And as we look through G and N, the 100% coverages pretty much mirror each other as we go through here. Obviously, the Part B deductible is missing. We just went over that. And Part B excess charges is missing as well. We'll touch on that. But you have the Part B coinsurance and copayment, and you have asterisks here next to that. So when there's ever asterisks, there usually means there's more to be had there. So let me dive into Plan N and explain how that'll work. Plan N is very similar to Plan G. It will cover the hospital deductible, so you don't have to pay that. It will cover the 20% coinsurance as well. You do have to pay your Medicare deductible. So that's going to mirror the G. You're going to pay the $226 deductible first. The difference with Plan N is once you meet that deductible, if you were to then go to the doctor, and this is where those asterisks came in, if you were to then go to the doctor after you paid the deductible, you'd have a $20 copay at your doctor. That's any doctor, specialist, primary care. And you'd have a $50 copay at the emergency room. So again, 20 at the doctor, 50 at the emergency room. Now, that's how it differs with those asterisks that were in that chart. But I do want to go over what excess charges is, because that was left blank as well. And this is kind of getting a little in the weeds, so I don't want to lose you here. We're just going to touch on this briefly. Part B excess charges, think of that as you have doctors that accept Medicare, and then you have doctors that will accept Medicare assignment, which is basically the approved amount that Medicare wants the doctor to take. So for doctors that do not accept Medicare assignment, they can charge up to 15% more than the Medicare approved amount. In certain states, this doesn't even exist. They cannot charge excess charges. So if you live in one of these states here listed below, excess charges do not exist on Plan N. But for the rest of you, less than 97% of doctors do not accept Medicare assignment. So 97% of doctors do accept Medicare assignment, meaning that of all the doctors in the U.S., 3% of those doctors will actually be able to charge you more than 15% of what the Medicare approved amount is. So I put here in big, bold, green letters that the net result is it really is a minimal role in Plan N because it's virtually never going to happen to you while you're on the plan. In my 6 years of doing Medicare, I've had 2 clients that it's happened to, and we've helped thousands of beneficiaries. So very minimal role in Plan N. So here's a good screenshot to take as well of a breakdown of Plan G and Plan N on how they can compare. Again, you got Plan G, which would have the $226 deductible, and you'd have Plan N, which has that same deductible. Difference here is once that deductible is met, you then have to pay a $20 copay at the doctor and a $50 copay at the ER. Plan N, because you have these copays on it, it usually is about $20 to $40 less per month in premium. So I put here, if you're going to the doctor anywhere from 12 to 15 times a year, that's usually your break-even point when deciding what plan's best for you. So let's look at what the cost would look like here if we chose the left side of that piece of paper, which was Original Medicare with a supplement. You'd have your Part A and B, which is the $164.90. The Medicare supplement is going to be anywhere from $70 to $150 a month, depending on your zip code, gender. The prices can vary. And then you'd be adding a Part D drug plan. I put here about $15 a month. Again, that will vary also based on zip code, medications you're taking. But this would be a good idea as far as what the premium would look like if you chose original Medicare with a supplement. In terms of when is the best times to enroll, we've already touched on this a little bit, but if you're going with the idea of original Medicare and a supplement, again, Part A and Part B, this is going to happen 3 months before your birth month, so you'll either automatically be enrolled if you're receiving Social Security, or you'll have to sign up on the Social Security website to get A and B. The supplement plan, this actually can happen up to 6 months before your birth month is when you're able to lock in premium on the supplement plan. We typically recommend doing that as soon as you're within that window because at that point you're locking in the rate 6 months before it actually starts. So you're getting the cheapest rate that you'll see because the rates don't go down, they always go up. You're able to avoid any mistakes that can happen with enrollment. And it's just something you can get checked off your list. There's going to be a few steps to take if you choose this process. So getting this one done first when you can, it always makes sense to do it that way. And then the Part D drug plan, this will actually happen 60 days before your birth month. So this will be one of the last steps that you'd tackle. But this is how your insurance would look if you went the original Medicare with a supplement route. So back to the two options. We went over the left side here. Now I'm going to touch on the right, which is Medicare Advantage. And again, I put here alternative to Medicare because when you go on a Medicare Advantage plan, you're not actually insured by Medicare anymore, you're insured by a carrier. And I'm going to illustrate that here on the next slide. So with Medicare Advantage, what it does is it takes your Part A, your Part B, and your Part D, and it lumps it all into one program. So I put here, it's a managed care organization. You're basically insured by a carrier, and you have an HMO or a PPO. So this is going to be very similar to you being insured either through the marketplace or possibly on an employer-based plan where you have one card for everything. So with this option, what will happen is you're going to have copays at the doctor, at the hospital. You're going to have a network of doctors and hospitals that you'll work within. And you're going to have what's called a medical maximum out of pocket. So you'd have a structured summary of benefits where you're paying copays for services, and you'd have an out-of-pocket limit, usually about $6,000, $6,700 I put there a year if you had a really bad year medically. So again, this is more of a similar option to what you've been insured with so far. And there's a lot of benefits to going on a Medicare Advantage plan. I'm going to touch on those here. The cost, more importantly, is the biggest factor is there's usually no or very low additional premium that you'll pay on top of your Medicare premium. To see a primary care physician, it's usually a low or even no copay to see your primary care. These plans will come with prescription drug coverage at no additional cost. They'll usually come with a dental, vision, hearing plan built into the program, again at no additional cost. With Medicare Advantage, in terms of plan options like we went over with the supplement, it's a little different. They have a number of different plan options based on your zip code and area. So when we plug in a zip code to pull up all the Advantage plans, we might find that there's 15 to 20 different options that we can pick. And that's going to be really tailored to your doctor network that you want to keep, medications you're on, etc. That would be what would show us what Advantage plan would be the best for you. As far as a cost of how it would work, again, there's no additional premium typically on an Advantage plan. So your Part A, your B, and D all lumped together, you'd only pay the Medicare premium of $164.90, which can make this appealing for some folks. In terms of when to enroll or the best time to enroll. So enrolling in a Medicare Advantage plan does mirror your enrollment into Medicare A and B. You got to be within 3 months of your effective date to do that. And you do need your Medicare card to do that. So as soon as you have your Medicare card and you're within that 3-month window, that is when it would make sense to shop the Advantage plans. And again, it's always best to do that as soon as you're within that window because it's something that you can get checked off your list. It avoids any mistakes. It gets the plan materials out to you well before the plan actually even starts, so you have time to review all that stuff ahead of time. So again, Medicare Advantage 3 months before. Medicare Supplement can be 6 months before your birth month. So again, these are the two options that you have. I want you again to just note that you have to pick a side here, the left or the right side. That's always your first decision. So in terms of original Medicare with the supplement and Medicare Advantage, I do want to go over the benefits and disadvantages of both. So to start with original Medicare, just to kind of bring this up again, the benefit of original Medicare with a supplement is going to be you have the option to choose any doctor or hospital. Your primary insurance would be Medicare, so there's no prior authorizations or approvals from carriers. There's no referrals needed, and there's no out-of-pocket exposure or surprise medical bills. If you're hospitalized, you pay nothing. If you have surgeries, you pay nothing. That's why you're paying for the supplement plan. Leading me to disadvantages. Obviously, a disadvantage of the supplement is it does require you to pay an additional premium every month. It does not include the dental, vision, and hearing like Advantage does. You can add this, but it would require you to pay an additional premium to add this. It does not include prescription drug coverage. Again, this would also be added. We budgeted about $15 a month on that last slide, but this would be added as an additional premium as well. In terms of Medicare Advantage, there are some benefits of Medicare Advantage. Again, with Medicare Advantage, there's no additional premium that you have to pay, just the $164.90. It comes with the dental, vision, and hearing benefits a lot of times. It comes with drug coverage, and a lot of the Advantage plans have what's called extra benefits. So Silver Sneakers, which is a gym membership program, it does come with that. Over-the-counter reimbursement programs where they give you, a quarterly allowance to use for over-the-counter medication. So those are some of the benefits of a Medicare Advantage policy. But there are some disadvantages of a Medicare Advantage policy as well. There's another old adage is you pay for what you get. So with an Advantage plan, because you're not paying any additional premium, you're just paying your Medicare $164.90, you incur costs on the plan as you use it. So I put here some of the copays you'll probably see on an Advantage plan. You'd have a $35 copay for a specialist. You'd have a $90 copay at the ER. Hospital stay is probably going to be the most costly, $300 a day or a night rather, for the first 4 to 5 nights. So with a Medicare Advantage plan, if you have a good year medically, it can be a good option. But if you have a bad year medically and you incur these copays and costs, it can start to add up for sure. Disadvantages of an Advantage plan, you do have a network of doctors that you're going to work within. If you are on an HMO, it will require referrals. Again, there are PPO options that do not require referrals. You have a $6,700 yearly out-of-pocket limit. So again, that can vary depending on where you are. That's just one of the more common ones that we do see. Basically, if you took all of your copays in a calendar year, if you ever hit $6,700, at that point, you would no longer pay anything. The insurance company would then cover everything for you. The last one I put here is actually pretty important. I'm going to touch on this again in the next slide as well. You may have to health qualify to go on a supplement after your initial enrollment. And some of you may be asking, well, why is that a disadvantage on the Advantage plan? So let me walk you through a scenario here. When you first start Medicare, you can pick the left or that right side, Medicare Advantage or a supplement, with no health questions asked. However, if you start with the right side, which is Medicare Advantage, because you're healthy now, after 12 months of your enrollment there, let's say your health went south and you're not healthy anymore, and you want to go back to the left side, original Medicare with the supplement, you will have to answer health questions in order to go from the right to the left after your initial enrollment on Medicare. So for some of you, that might not be a problem. Some folks go on the Advantage plan, they love it, they don't pay any premiums or copays, and they're healthy and they're happy. But I have seen situations where someone's on an Advantage plan and they've had something come up, cancer, dialysis treatments for kidney failure, and they want to go back to a supplement plan. The problem is after the first year of enrollment, you have to health qualify. And for some folks, you might not be able to if you can't pass through the health questions that are asked. So that's something that's important when you're looking at picking an option here. You do have to weigh not only what's going on now in your health now, but also how you want it to work in the future, because you might not be able to change if you need to later on. So that was the recording of our last Medicare educational webinar that we put on, where we go over, again, the two roads of Medicare. You have to pick one of these options when you're comparing Medicare Supplements versus Medicare Advantage. If you're still confused or have any questions, I just posted our number here on this video. One of our agents would be glad to walk you through the options. If you'd like, you can click the link that says schedule a consultation as well to be put on our calendar for a one-on-one consultation with one of our agents. Again, hope you enjoyed the video. If you did, please hit that like button. The way that YouTube works is the more likes a video has, the more popular it becomes, the more people that will be able to see it. Our goal is to help as many people as we can. If you'd like to be notified as we post new Medicare news and update videos, click that red subscribe button below and they will notify you as we post new videos. Again, if you'd like to leave a comment in the bottom here, my team and I go through that personally. I'm happy to answer any questions that you have, so feel free to ask any questions in the comment section or drop a comment in there on what you thought about the video. Again, this is Medicare Joe, and I want to thank you for taking the time to watch our Medicare Supplement versus Medicare Advantage video. As always, our goal is to make Medicare simple. Take care.